Cardona, and today I will be reviewing with you how to read and interpret an explanation of benefits from your insurance carrier, as well as discuss with you some basic terminology that will help you better understand the claims process. To begin with, an explanation of benefits, or EOB for short, is exactly as its name implies. It's an explanation of what your insurance paid or covered, or in some cases did not cover, for a particular service rendered or doctor's office visit. An EOB is sometimes referred to as a remittance advice, or RA, or it can be referred to as a health statement. Regardless of what your insurance company labels it, the information is essentially the same, and explanation of benefits, or EOB, is the universally accepted and understood term between insurance carriers and healthcare providers. There are many reasons why it's important to be able to interpret an EOB. To begin with, you want to ensure that your medical provider is not overcharging you or undercharging you for a particular service rendered. The explanation of benefits will tell you exactly how much you have to pay to your medical provider. Another reason it's important is you want to be sure that your insurance carrier is correctly paying for services under your benefit plan. Let's get started. While the format may vary slightly between insurance carriers, most EOBs look a lot like this. Here, you see the label, Explanation of Benefits. Over here, you've got the name of the insurance company. The explanation of benefits will also have the member name. Sometimes this is also the patient name. Sometimes the member is the subscriber of the plan, and it will have a separate section for the patient if the patient were somebody else listed on the plan, such as a child or a spouse. The EOB will also have your member number and a claim number. The claim number is used to identify a particular bill from your medical provider to your insurance company. If ever there is an issue with how something is processed, you can call your insurance company and provide them with the claim number, and they will be able to readily pull up and identify the particular services you're referring to. The first column on the EOB is the date of service, and that's the date the services were actually rendered. If it were a hospital stay that spanned several days, all of those dates would be listed there. The next section is the procedure code. Now, not all EOBs have the procedure code listed. The procedure code is a 5-digit code that identifies to your insurance company exactly the services that were rendered. In this case, the first procedure code is an office visit or other outpatient visit, and the second procedure code is for an X-ray. Those descriptions of the procedure code are generally listed directly after the procedure code. The next column is the amount billed, and this is the actual amount that your medical provider or doctor sent to your insurance company and is requesting payment of. However, the amount billed is generally not what your insurance company pays. The amount that your insurance company pays is the allowed amount. Now, the allowed amount is based on the contract between your doctor and the health insurance carrier. The allowed amount will be different depending on the doctor, the procedure, and the health insurance carrier. That is to say, Blue Cross may not pay Doc McStuffins the same amount that Aetna would pay them. Followed by the allowed amount is the amount paid. That's the actual amount that your insurance company paid to your doctor. The columns in green represent patient responsibility amounts. In this case, there's a $0 deductible, a $15 copayment for the first row, which is the office visit itself, but not the X-ray, and a $0 coinsurance amount. The next column shows what you owe, and this is exactly how much you are required to pay to your medical provider. Now, copayment and coinsurance are often used interchangeably, but they are not the same thing. A copayment is a set dollar amount that you're required to pay to your providers for office visits or other services. Usually, a PCP may be $15 or $20, whereas a specialist may be $30 or $35. A coinsurance amount is a percentage that you have to pay. So if your particular plan requires that you pay 20% of the visit and the X-ray, then you would be required to pay 20% of the allowed amount of $88.97. After the patient responsibility amount, you'll see remark codes, and these are just codes that indicate why your insurance company processed something in a particular manner. For the most part, they're informational, but they are important to review to make sure that everything was processed correctly. In this case, the remark code 1 indicates copayment is required, and it shows you that $15 is owed. And the second remark code indicates the amount that is not covered under the contract, 6103, which is the difference between the amount billed by your healthcare provider and the allowed amount. One of the terms that I hear used incorrectly quite often is covered versus non-covered. If your insurance company applies something to your deductible, it's covered. Just because they didn't pay it doesn't mean that it's non-covered. It is covered, you just owe the deductible. Now, a non-covered service would mean that you are responsible for paying the entire amount charged by the physician. There are several reasons why a service may be considered non-covered by your insurance carrier. For example, a particular condition may not be covered under your benefit plan. Another example, which a lot of insurance companies are moving towards, are emergency services for non-emergent diagnosis. That is to say, if you go to the emergency room, but you're not having a true emergency, they may not cover the visit at all. Now, while what I've reviewed with you today is not a complete listing of all the possible outcomes of a claim processing, it will provide a good foundation for most of the basic services that you have done. I hope the information today has been informative and will help you in dealing with your insurance carrier and your medical providers. Thank you for tuning in.